tomorrow is my first consultation at UK Vein Clinic. I've had my varicose veins for about 15 years. I had them when I had my daughter a year or two ago. It was quite a hot summer, and I found that they started to throb and kind of itch as well. It started to affect me and sort of affect what clothes I was going to wear and how confident I was showing my legs. It just feels like time now. It's probably normal to put yourself right at the back of the queue for what you need, but now I think I deserve to feel and look the best I can.
You need to scan the veins from your groin down to your foot,
Right.
Because we all have one big vein that comes from the foot and drains blood here.
Yeah.
And if this vein is not working, sometimes can feed veins on the side.
I wanted to show you what my leg was looking like ahead of treatment. So here you can see my left calf, and my other leg doesn't have any varicose veins.
So I'm just looking at this black circle over here. This is called the great saphenous vein. It's one of the biggest superficial veins that comes from your foot. It goes all the way up into your groin, and when it goes into the groin, it will meet with the deep veins. So after a release, you shouldn't see any color, but you can see that there is a lot of red.
Yeah.
So that means that this vein is actually incompetent, which means that instead of pushing the blood up, it's letting some of the blood to return down.
Right.
And eventually with time, that blood found an escape route and went into a side branch and fed into your varicose veins. Your arteries are really good as well, just because I'm looking at it.
After my scan with Fabrizio, it was time for me to meet with one of the vascular doctors at UK Vein Clinic to discuss the scan results and also talk about my treatment.
We're going to have another look. I'll take some photos as well.
Yeah.
And then I'll talk to you all about your scan findings,
Brilliant.
what it means, what we can do.
Excellent.
Does that sound okay?
Yeah, lovely. So now that I've found out what's going on, I am excited about getting the treatment. I've kind of been putting it off in the back of my head and sort of putting it off and thinking, oh, I'll deal with it. But just because there's a few processes, I'm really glad I got it done now and didn't wait till it got really, really bad. And now I'm just really keen for those vessels to be sealed and the problem to be remedied. So yeah, I'm looking forward to starting.